So what is an acquired brain injury? It is a non-progressive injury to the brain after birth resulting in an acute or chronic disruption of neurological functioning. A traumatic brain injury is a disruption of the normal function of the brain that can be caused by a bump, blow, or jolt to the head suddenly and violently hitting an object, or an object pierces the skull and enters brain tissue. Symptoms vary greatly depending on the severity of the head injury. Some symptoms may be vomiting, headache, confusion, dizziness, cognitive difficulties, dilated pupils, speech difficulties, body numbness, and tingling. Traumatic brain injuries can cause mass lesions within an area of localized injuries such as hematomas and contusions that increase pressure within the brain. A hematoma is a blood clot within the brain or on its surface. A contusion is a bruising of the brain tissue. Some other traumatic brain injuries may include skull fractures, abuse, head trauma, and concussions. Traumatic brain injuries often occur as a result of severe sports injuries or car accidents. A non-traumatic brain injury can be the result of an illness, oxygen deprivation, metabolic disorders, aneurysms, cardiac arrest, and nearly drowning experiences. It includes injuries to the brain that are not caused by external physical force to the head. Common non-traumatic brain injuries include anatonic/hypotonic ischemic injury, toxic or metabolic injury, encephalitis, virus, brain tumors, meningitis, pediatric stroke, drug abuse, and hydrocephalus. Toxic or metabolic injury occurs after coming into contact with unsafe substances or the detrimental acclimation of chemicals manufactured within the body. The virus is the most common cause of non-traumatic brain injury.
My son, at the age of 12, was diagnosed with nasopharyngeal carcinoma. It's a type of cancer is in the back of your throat. Due to chemo and radiation, the cancer left him with frontal lobe deficit disorder. Frontal lobe deficit disorder is an impairment of the frontal lobe that occurs due to disease, which was his cancer, or head trauma. The frontal lobe plays a key role in higher mental functions such as motivation, planning, social behavior, speech production. It's involved in reasoning, motor control, emotions, and language. It contains motor cortex, which is involved in planning and coordinating movements. The prefrontal cortex, which is responsible for higher learning, higher level cognitive function, and the Broca's area, which is essential for language. The causes of frontal lobe deficit, again, trauma, tumors, degenerative diseases, neurosurgery, and cardiovascular diseases. The treatment for it could be antibiotics to treat the infection, surgery, which we use to try to remove the tumors, chemotherapy, radiation, cognitive and behavioral therapy, and rehabilitation.
Rehabilitation channels the body's natural healing abilities and the brain's relearning processes so an individual may recover as quickly and effectively as possible, and involves learning new ways to compensate for abilities that have permanently changed due to brain injury. Rehabilitation focuses on being able to enable individuals to perform their activities of daily living safely and independently so they can move on to other forms of rehabilitation or transition to their home. Some different types of rehabilitation are acute rehabilitation, post-acute rehabilitation, subacute rehabilitation, day treatment, such as day rehab or day hospital, and outpatient therapy. A child recovering from an acquired brain injury may cause some impairments in certain areas, so the rehabilitation process helps them conquer these difficulties and help them perform better with everyday activities. These areas may include motor skills, gross and fine, sensory, hearing or vision, feeding skills, communication, cognitive, and behavior.
For my son, the symptoms were he had swollen lymph nodes. So when I first took him to the doctor, they said it was just his adenoids inspected. So I was at the doctor for like every week with him, once a week for like a month, trying to figure out what was going on, because at some point his neck had stiffened up and he couldn't turn his head at all. So by the time we was at the 4th visit, it was then that he was sent to the ear, nose, and throat doctor, and I found out about the cancer. Nasopharyngeal cancer is rare. So the way he's contracted it, it was through someone he came across had Epstein-Barr virus, which is human gamma herpes virus 4. That's what it was normally formerly known as, and that is a virus that is spread through saliva. So he could have got it from sharing somebody's eating utensils, drinking glasses, cough and sneezing. He went through, like I said, the treatments. He went through chemo, radiation. You could also do surgery, but where his tumor was inoperable, so we just stuck with the chemo and radiation. Finished up his radiation, all that. We went to see a neuropsychologist. She ran some tests on my son because I had noticed some different changes in my son, who was still 12 at the time. These changes were more so in his behavior, how he kept his room, school. He wasn't doing too well in school. So after she did the test, that's when I found out about the frontal lobe deficit disorder. I then got involved with his schoolwork, his schooling, and I got him a IEP, which we, put in place things that can help him to succeed in school, which he did. He ended up graduating high school on time, and he's now 21, and he's cancer-free.
The article that we decided to use in our project is titled Recovery After Mild Traumatic Brain Injury in Patients Presented to U.S. Level 1 Trauma Centers. It examined impairment post-injury. It found that on average, patients report impairment 12 months post-injury, while others report impairment as early as 2 weeks post-injury. It concluded that it is best for patients to attend all follow-up treatment and to seek further therapy as needed. So we decided to use BrainLine as our website. On this website, you can get general information about brain injuries. However, because we're focusing on children, you're going to go right here to the menu, click on Children with TBI. It'll bring you to this webpage where there are numerous topics that you may be able to click on based on your concerns and interests. We're going to click on the very next topic, which is concussion in kids. It'll give you a brief synopsis. And as I stated earlier, based on your interests and your concerns, you can click on any of the provided links. The last feature I would like to show you all, if you go back to the top, click on menu, resource directory, you can type in your city, state, or zip code, choose your resource type, and it'll bring up a list of resources in your area. Or you can go down here to the bottom, click on the state that you live in, and it'll bring up resources in your area.